My name is Richard J. I'm presenting on the topic the emotional job stress of COVID-19 on nurses working in isolation centers, a machine learning approach. This will be the outline for my presentation. I'll go through the introduction through to the discussion. The outbreak of SARS-CoV-19 virus in the late 1990s and the subsequent evolution of the 2019 disease have affected the world on an enormous scale. The negative impact ranges from the full or partial lockdowns and quarantines with negative economic impact, while hospitals and research institutions are constantly making efforts in various containment, vaccine development, and treatment of isolated patients. It is very critical in addressing as soon as possible the unavoidable long-term emotional and mental health effects of destabilize the global societies, not forgetting frontline nurses working in isolation centers. We set out in this article to model and predict the emotional impact of COVID-19 on these frontline nurses to prefer digital-based interventions. The COVID-19 pandemic is novel in all its ramifications and requires datasets that capture frontline nurses' effective responses to it while working in isolation centers. Machine learning algorithms have been used to collect and analyze data in emergency rooms, but there remain gaps in research. Considering these negative outcomes coupled with the gaps in the extant literature on the emotional impact of COVID-19 pandemic and the depth of perception derived from the psychosocial experience of frontline nurses in isolation centers, we came up with these two objectives. One, we want to provide an overview of scientific evidence regarding the emotional impact of COVID-19 on frontline nurses working in isolation centers. And finally, we want to predict the emotional impact of the COVID-19 pandemic on frontline nurses working in isolation centers using machine learning algorithms. So in literature, we know that machine learning is attributed to the capacity to learn and retrieve meaningful patterns from the data. Machine learning has found application in social phenomena such as sentiment analysis and emotional detection. It uses labeled data in predicting a document as neutral, negative, or positive. Machine learning algorithm can be applied during mental health difficulties in real time, as was implemented in similar emergency globally. In methodology, data was obtained from 543 nurses working in isolation centers in one of the top four African countries from South Africa, Nigeria, Algeria, and Ghana, who are hardly hit by the COVID-19 and developed into corpus. Specifically, each frontline nurse rated how affected they were by the COVID-19 situation and how much anger, anxiety, worry, fear, sadness, and neutral they felt about their situation during the period relating to their job. They answered questions on their emotional status a month before the COVID-19 to differentiate how they felt before during the COVID-19. So the pre-processing, we developed fundamental emotional themes consisting with basic emotions like disgust, anger, fear, anxiety, sadness, happiness, relaxation, and desire, which were proposed by Hammond Jones et al. 2016. Manually assessing the test, we came up with the 8 distinct basic emotions. However, we analyzed a tenth of the corpus worth of samples to arrive at the basic emotion categories of worry, anger, anxiety, and sadness, where anxiety equal to either anxiety, nervousness, tenseness, and fear, and depression revolves around suffering, sadness, and disappointment. With the predefined emotion categories, 3 selected coders coded each instance of the corpus after pre-processing. The pre-processed corpus was sent to 3 qualified coders who met the recommendation and guidelines of Kellogg et al. 2018 for annotation. In a few instances, having 2 emotion categories, the coders settled on the main keywords. Now, the following are sample corpus with some codes obtained from the coders test instances, which typifies sadness, depression, and anxiety. The impact of COVID-19 pandemic on frontline nurses working in isolation centers was predicted using the Worker machine learning software by the researchers. In predicting the emotions in the test using Worker, we made use of tenfold cross-validation for both the training of the emotion categories as well as the prediction. This was finally compared with natural and human-coded corpus to enhance the efficiency of the machine prediction. And so you look at the conceptual classification process adapted from AJ et al. 2018. So you have the frontline nurses, we collected their account, we annotated them, and then the emotional account of the frontline nurses were grouped into features and then split into tested data and training data. We got a classifier, the model, and the classification. Now, while using Worker for support vector machine, we use sequential minimal optimization. A study by Colloq shows that SVM excels under condition of having a large amount of training data. So prior to the performance of the SVM classification tags, feature words were carefully extracted from the text instances using various approaches including tagging, part of speech, and tag bag of words. So when looking for trends in the data, the authors turned to the linear kernel, which provided the best performance overall. Now, of the 543 respondents, 48.8% were male frontline nurses and 51.2% were females. So considering age as a significant moderating factor in psychosocial and emotional behavior, we categorize the age brackets of the frontline nurses as illustrated in figure 2. Now, table 1 is the emotional categories with intercoded instances for percentages in the corpus. So you can see clearly that the emotional category like sadness have 283 number of coded instances, which represent 52.1%. Now, pattern of coding of the respondent based on the emotion categories. So we can see that a kappa score obtained reveals the distinctiveness in the coding pattern as presented in figure 3. Now, it is dependent on the predefined emotion categories where 1 is equal to anger, 2 is anxiety, 3 stand for sadness, 4 for worry, and 5 for neutral. Now, the discussion. Indeed, over 75% of the frontline nurses experienced significant levels of emotional disorders above the normal period while working at the isolation centers. So, from table 1, 52.1% of the coded emotion is attributed to sadness. Impliedly, the majority of the frontline nurses expressed a feeling of depression because the COVID-19 pandemic followed by anxiety or fear. Our result is consistent with that of Shegumura et al. In 2020, who argued that COVID-19 pandemic poses a significant threat to mental health around the globe by elevating rates of anxiety and depression. All the negative emotions triggered by COVID-19 viral infection support previous studies, which posits that healthcare workers are at high risk for mental illness in times of viral outbreaks like coronaviruses, particularly that of Bendu and colleagues in 2021. Their study revealed a significant number of healthcare professionals reporting acute symptoms of high psychological stress, depression, anxiety, insomnia during COVID-19 pandemic. Comparing all the negative emotions, only 2.4% of the participants indicated neutral emotion category. The implication is that 2.4% of the participants did not feel any emotional impact working in a COVID-19 isolated center, which is inconsistent with a study on anxiety and depression, which was prevalent among primary healthcare workers, which may be implying that some frontline nurses refused to reveal their emotional status. Now, the result from the table, we can see that anxiety is the highest predicted emotion category by the SVM classifier in the test corpus, followed by sadness. Significantly, worry and anxiety predicted by the SVM classifier were all higher than the acceptable threshold of 70%. Similarly, the highest personal frontline nurses emotion category predicted by the MNB classifier is anxiety. Comparatively, worry was the lowest relative to predicting emotions in the test corpus. A comparative analysis of the best performing classifier between SVM and NMB is the SVM, even though the distinction in the predictive performance between them is insignificant as illustrated in table 2. In conclusion, the researchers discovered that levels of negative emotions among the frontline nurses during COVID-19 pandemic was higher than the normal. So the sensitivity of their risks was also considered. Regarding well-trained human coders, sadness remains the most salient emotion expressed by the frontline nurses. Nonetheless, the machine learning prediction was most accurate in predicting sadness with notable variations across the other emotional categories. SVM classifier performed better than the humans at predicting the participants' emotional reactions to COVID-19. Since mental health professionals are in short supply, especially in Africa, it is suggested that machine learning be used in digital psychiatry to help fill the void. Thank you.